me, I got to see all of the most interesting cases in the hospital. As a pathologist, I could see all of the coolest diagnoses. You could handle some of the more complex problems that were going on. And so for me, pathology really checked a lot of boxes in terms of being able to see a bunch of challenging cases and really stretch myself.
I really like that it's challenging intellectually. You're not dealing with a lot of social issues. You get to just focus on medicine and focus on diagnosis and focus on anatomy, which I think is more rewarding and more challenging.
I did some research during my med school years as part of the MD PhD, and then looked around and surveyed the scene to see what type of specialty would accommodate a person like me with those types of interests, and pathology stuck out. It was a very obvious choice for me, and I couldn't be happier that I made it.
To me, diagnosing something is sort of like solving a mystery, solving a puzzle. It's really cool to correlate what you see under the microscope with what the patient is presenting, and sort of put those two pieces together and present a full picture to the clinicians so that they can come up with the best, treatment plan for the patient.
The reason I chose to go into pathology is because I really considered pathology to be the most complete medical specialty. I really have just been attracted to the breadth and depth of knowledge that pathologists have, and in particular for me, my interest started from when I first saw an autopsy, and I really kind of consider that to be the culmination of all my medical knowledge, the anatomy and the physiology, and putting all these things together in one.
I really like the tactile aspect of pathology. I love seeing the tissue, seeing the disease, being able to stage the disease with my eyes. And then it's really cool to see the disease process at the molecular level and at the cytologic level. There's a mutation, and then the cells proliferate uncontrollably, and then we see that molecularly at our sign out. We can see those mutations, and then we can also see it on the scope, see the disease, and then clinicians really see how that affects the patient, and then how they present. But we really get to see the disease process at a much more granular level, and I love that aspect of what I do.